Okay. Here we go. Hey everyone. I'm so excited to be presenting to you today. Welcome to the annual meeting for LeadingAge of New Jersey and Delaware. My name is Patrice Schaffer, and I am a business development specialist at Navitend, which is a managed information technology company, and we're located in Stanhope, New Jersey. My primary focus here at Navitend is to build awareness for the company's cutting-edge IT solutions. We have a wide array of services we offer, including cloud computing, security management, 24/7 help desk solutions, mobile device management, and IT consulting. I'm very passionate about helping companies and our clients gain confidence that outsourcing IT management and support allows them to focus on their business strategies instead of dealing with the daily IT delivery themselves. I've been a speaker for several different organizations, including the Mount Olive Area Chamber of Commerce, the United Way of Northern New Jersey Women's Leadership Group, the New Jersey Healthcare Network, and the Morris County Chamber's Ask the Expert program. Prior to Navitend, I worked in many different fields, including computer programming, finance, sales, marketing, and storage solutions. My education includes a Bachelor of Science degree in Computer Information Systems with a concentration in Business Management from York College of Pennsylvania. I currently reside in Long Valley, New Jersey with my husband, Michael, of 33 years, and our 3 daughters. So let's get started because I have a lot of information I just want to pass along to you guys. So today's topic I'm going to be discussing is helping your employees understand cyber risk and keeping patient information secure in a bring your own device environment. We call that BYOD. So you're going to see BYOD throughout the presentation. So I'm going to go over the agenda. We're going to go over some statistics. We're going to talk about ePHI in a mobile world, digital and telehealth definitions and benefits, an overview of HIPAA requirements, HIPAA and COVID-19, video apps, what's permissible now, HIPAA compliant, and what's not allowed, and what's BYOD, bring your own device, mean, and bridging the gap between HIPAA and BYOD. And lastly, I'm going to give you a whole bunch of successful tips to implement a bring your own device policy. So just a couple of quick statistics from an article I found. The article is called 41 Stunning BYOD Stats and Facts to Know in 2020. So one of the reasons why I did the stats is because as personal devices create ever increasing opportunities for connectivity, the lines between professional and personal use are, it's just a way that professionals have been boosting their productivity in a way that right now you're going to see 67% of employees access company data on their mobile devices. So we found that businesses are hungry for the efficiency and are responding with a BYOD or bring your own device program or policy. So as I mentioned, 67% of the employees use personal devices at work. Bring your own device generates $350 of value each year per employee. A bring your own device carrying employee works an extra 2 hours. 87% of businesses are dependent on their employees' ability to access mobile apps from their smartphone. 69% of IT decision makers in the United States say that bring your own device is a good thing. And bring your own device market size is expected to reach $366.95 billion by 2022. 59% of organizations adopt a bring your own device policy or program. And again, I have the link at the bottom of the display here, and I think everybody will be getting a copy of the presentation. If not, I can definitely email that to everyone. So, electronic protected health information in a mobile world. We all know that ePHI is electronic protected health information. Everyone by now should be familiar with that, what that entails. So ePHI is basically the information that has to do with your patient, like even zip codes in that data is considered electronic protected healthcare information. So you want to remember that your data is the lifeblood of your organization, along with the other systems that you have in place. So you need to make sure that the electronic protected health information is being maintained properly and protected. So in order to do that, I've got a couple of things down here. One is you want to conduct a robust risk assessment. So it's critical to conduct this. Because you want to achieve these objectives. So one, you want to identify where the protected health information is stored, received, maintained, or transmitted. You want to identify and document potential threats and vulnerabilities. You want to assess current security measures used to safeguard the PHI. You want to assess whether the current security measures are used properly. You want to determine the likelihood of a reasonably anticipated threat. And what I like to say about that is kind of run a fire drill. You know, you want to have a fire drill that you're going to anticipate that a threat's going to happen. And when you're doing that fire drill, what are you doing in order to get the information that you need, and how are you going to protect it? So it's good to do that. Determine the potential impact for a breach. Same thing. It's like a fire drill. Like you want to kind of play that that a breach is happening, and how does your organization react to that? Assign risk levels for vulnerability and impact combinations. Document the assessment and take action where necessary. So these things that I am talking about, then we lead into policies and procedures. So it's imperative that covered entities finalize and fully implement all HIPAA policies and procedures. You should document these policies and procedures, and you should have training sessions for all of your employees so that they're aware and that they understand the potential risk that if unauthorized access or disclosure of that information should happen. And then lastly, on this slide, we want to talk about encryption. And encryption is basically, locking the device, so to speak. It protects the devices, whether it be, a laptop, a tablet, or a cell phone. It's important to have the policies and procedures in place for all of your devices, so that they're encrypted. So in the event that, it should be lost or stolen, at least the person won't be able to get in because it's encrypted. So we're going to get a little bit into this talk about telehealth. So what is telehealth? The definition of telehealth is the use of medical information exchange from one site to another via electronic communications to improve patients' health status. And that came from the American Telemedicine Association. But in my terms, I'd have to say that to me, telehealth means any type of consultation that's not delivered in the traditional face-to-face way. So it might look like a consult over the phone, or utilizing different video conferencing software on a laptop or a tablet, or even your phone or your desktop. And you want to make sure that the patient gets the care that they need and the support that they need. So you can do all that. So this allows a patient to have a health appointment from anywhere that they're located, such as their home, or even on vacation. Right? So if they're visiting somebody and something should happen, they could have that. I wanted to share an experience with you. I recently had a telehealth visit with my doctor just a couple of weeks ago. So what had happened was about a month and a half ago, I was cleaning in the kitchen and I dropped a glass on my foot and I cut my foot. And that's not where I had the telehealth visit. I had to be actually rushed to the hospital and I had several stitches. But what happened afterwards is I went to my podiatrist and she actually took the stitches out and then wanted to do a follow-up. And she said to me, hey, we could do a telehealth. You could call in, we'll use this. So that's what I did. And she was able to treat me over the phone. She just looked, I showed her my foot through the video conferencing software, and she was able to view it to make sure that, there was no infection. So that was quite interesting, I have to say. So what are the benefits of telehealth? Well, here we have reduces risks. So with telehealth, patients avoid the risk of infection from other patients when visiting a doctor's office or hospital. And because they communicate from home, they avoid the risk of having an accident even while traveling, especially if the weather conditions are not so good. So it saves time and money. Patients that receive on-the-spot care via video chat instead of waiting for their next appointment, they're not wasting the time traveling or sitting in the waiting room, like I said, and it saves money because these appointments are less expensive insurance-wise. Reduces trips to the hospital. So especially in a senior living community, I would imagine that the ability to connect with a doctor, nurse, or specialist in real time can eliminate the need for a transport to the hospital. And also, I do believe that not all senior living facilities have a doctor on site 24/7, so this obviously has become a vital option for them. And convenience, when a medical issue happens on weekends or holidays or other times, and the doctor's office is closed, there's no need to maybe wait for a scheduled appointment. If your caregiver, your provider has that telehealth option, then you can obviously use it during that time. And it keeps caregivers connected. So caregivers then are able to sit on a video conference, with the healthcare provider and the patient, allowing them to stay in the loop, and they can ask important questions or they can give important information. And they can even monitor their loved one's health conditions from afar, and, do the remote. So what is digital health? Digital health is a broad term which basically refers to any hardware or software technology that supports health or health systems. So supporting the telemedicine, as a matter of fact, right? So for example, through online patient portals now, patients can connect privately with their providers from the comfort of their home. They can receive health support through that. Most of us spend a lot of time every day on our digital devices such as smartphones and the tablets and laptops to do almost everything imaginable. We do banking, shopping, keeping in touch with our family and friends. So thinking if you have your cell phone, I'm just wondering, everybody's probably gone to the App Store at one time on your smartphone, and you search through the apps that are available. There's a lot you can do when it comes to taking care of your health. There are a lot of apps that will track like your health and diet. You can book appointments online with your doctors. You can order prescriptions, set up delivery times. But think though, of all of these apps online, you want to think, where does the data go and who can see it? So I'm not going to go through each and every one of these, but you can clearly see the benefits of the key concepts listed here. So for instance, education and engagement. Example, think of, your Fitbit or your Apple Watch and other wearables that track everyday exercise and and diet routines. So that would fall under that category. For screening and diagnosis, right? Did you ever Google a symptom? You know, you go to Google, you write down a symptom, hit enter, and then you want to read about it, and you read about those symptoms and what you should do before maybe you're going to the doctor to say, hey, I have these symptoms, could it be, blah, 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 you know. Access to care. We Google doctors near us all the time, right? So you were looking for a doctor. Maybe you want to look at reviews of the doctor. You know, what is a good doctor? I'm going to read the reviews to find the best one. We can make appointments or have video chats, and we can have medical information transferred to get a second opinion, all through digital health. Care management and community. It's similar to what I talked about in the abstinent education. But if you think of like Noom, I don't know if you've heard of Noom, but that's fairly new. It's a health app that, you know, helps you lose weight, monitors what you're eating every day. You know, you're weighing yourself. All that information is going, you know, through your smartphone or your tablet. Weight Watchers, My Coach. These apps bring in the community also to encourage you, and it allows you to share and encourage others as well. So that those are, it's kind of like a social media site, really, when you think about it. And then core insurance services. This would help you to possibly budget or financially understand the costs that are involved, so you can, you know, you can decide what the right pathway is for you. So here I have common thread and privacy concerns. That's what actually the common thread is. The common thread is the privacy concerns. And how does all of this relate to, you know, protecting patient information? So we have mobile applications. There's countless mobile applications that allow the collection and monitoring of all types of personal data to optimize exercise and health-related activities, as we talked about before, administering and regulating medications and tracking our diets, managing and treating chronic conditions, and notifying us maybe of abnormalities that, you know, might occur in our bodies if we're wearing a wearable, that sort of thing. If we're homebound, you can now interact remotely with healthcare providers, you know, during COVID, obviously, that's a big one. There's virtual house calls by sharing images and other data and receiving real-time diagnosis and treatments and prescriptions, almost like I had mentioned when I had gone to my podiatrist. So devices. Again, wearable and implantable devices, they work in combination with all of the applications to extend these healthcare capabilities even further. You have AI, artificial intelligence, right? So that's being applied with smart devices that, you know, amputees can use for prosthetic devices. You know, somebody loses a limb, now they're smart, and they're putting them in there so that they're communicating with all of these devices and applications. And that it's a way to engage activities with performance that exceeds, you know, that of a natural limb. So, and we have privacy concerns. A common thread here is the privacy concern, and it's a threat or possibly a concern because it, you know, of all these things that are connecting, all the innovations that are happening, it's made possible, but we're also doing the collection, analysis, and subsequent application of extensive health information, right? And other personal data and data sets. So think, like I said earlier, where's the data stored? Who sees it? How is it protected? Because personal health information and related financial information are among the most sensitive types of personal information that's out there, in a matter of which such data is gathered, handled, and stored requires careful attention. And that's going to lead me into one of our favorite discussions, HIPAA requirements. So everybody already knows what HIPAA, which is Health Insurance Portability Accountability Act, is. So I don't necessarily need to go through that in fine detail, but HIPAA is still much in effect, and even during COVID. So I wanted to make sure that you all have a clear understanding and follow the requirements. So a risk assessment of your organization. If you have not done a risk assessment in your organization, now is definitely time to do it. You should put one together. It is a requirement to have. There's an easy outline of what a risk assessment includes, especially now that your organization has probably changed slightly. You know, due to the pandemic, you probably have workers or employees that are remoting into your network, and that would be as a change and should be noted in part of your assessment. And if you do already have one, you should have updated it to, you know, because of that definite change, that slight change. A risk assessment shows you where the gaps and the weaknesses are surrounding the data that comes into your system and goes out of your systems. So if you do have a vulnerability that is defined in doing a risk assessment, then you can plan to fix that vulnerability or that risk. You could design some planned projects based around them. When you implement them, you document that you're doing that. And when you have that documentation, if a breach should ever happen, then that documentation is available. So it would definitely help you either possibly avoid a HIPAA-related fine. It could even eliminate it. It just depends on what it is. BAAs, business associate agreements. These are definitely required. A BA you should set up with all your third-party vendors. Basically, anyone who accesses any of your patient data needs to sign one. And a good example of that would be your IT vendor. And training staff on the basics of HIPAA. This is ongoing. It's not just, you know, you hired somebody 20 years ago and they had the training and that's it. This is, they need to be trained on HIPAA. You're required by law to train your employees to keep your information safe. If you house sensitive data such as health records, addresses, diagnosis, etc., you're a covered entity. The employees need to be trained ongoing. So just put this in here real quickly. You know, what is HIPAA change due to COVID-19's national emergency? So pivot here a couple of minutes just to discuss this. I'll just read it. Healthcare professionals can now use phone, text messaging, and/or video apps to communicate with patients within the new guidelines in order to assist the patients. The Office for Civil Rights will not impose penalties for non-compliance with HIPAA rules in connection with the good faith provision of telehealth using such non-public facing audio or video communication products. So I put that in here because my next slide is going to talk about with telehealth and the video apps that are now permissible. So these are newly added video apps that are now permissible through HIPAA, from HHR. Typically, these platforms, you know, employ what they call end-to-end encryption. It allows only the individual and a person with whom the individual is communicating with to see what is being transmitted. The platforms also support individual user counts, logins, passcodes that will help limit access to verify who the participant is. In addition, participants are able to assert some degree of control over particular capabilities, you know, such as choosing to record or not record the communication. They can mute very quickly, turn off the video or the audio at any point. And these are the ones that are newly added. It's Apple FaceTime, Facebook Messenger video chat. And I just want to say here, it's not Facebook, as you'll see in a couple of slides I put in there. Facebook Live is not allowed, but the Messenger video chat is. Google Hangouts video, Skype, and any apps that are not public facing. So which apps are already HIPAA compliant? So I'll list them out here for you. So these apps have already, these vendors have already signed a BAA with HIPAA. That's why that they're technically called HIPAA compliant. They do protect the patient's information. And I know there's a lot to choose from here. These tend to be a little bit more expensive because you get the additional security when using these apps. And I discussed public facing before. Maybe I'll just tell you really quickly because I realized I didn't explain exactly what that was. Public facing means that they're designed to be open to the public. So it allows open access to the communication. So apps that are considered to be public facing that are not HIPAA compliant include, like I said, Facebook Live, Twitch, and TikTok, and any similar video communication applications that the public can see. So I thought we could kind of do a quick fun slide. I'm pretty much about halfway through the presentation. And so what I decided to do here is I have these really cool sneakers, as you can see there on the slide. And we call these Shermies, and they're Converse sneakers, but they have our logo on them and navitend, and they're going pretty quickly. I've been using them in my marketing for a couple of months now. And so I wanted to offer anybody who wants a free pair. I have all different sizes. So what you could do is you can log into our website, and I give the website there and that link. That link will give you also a complimentary human security assessment. That's something that navitend does, and it's something that we talk about quite all the time, is that humans are the #1 threat to your business. So there's a little assessment that we give out. It's free as well. So I just wanted to offer that. I want you to act quickly because the offer ends on October the 21st at 5 p.m. And I know I'm recording this early, but that would be tomorrow. So definitely act quickly and get a pair of those sneakers because they are very cool. So I just wanted to throw that in there. It's kind of fun, you know? Going back now. So what is BYOD? Bring your own device. So, and it's defined as the practice of allowing employees to bring to the workplace their own mobile devices that are capable of connecting to the internet, and they're capable of connecting to your company's network. The devices can be laptops, smartphones, tablets. It could even be a gaming device. So why is it important? Why is BYOD important? Well, they found that it's increased productivity. Companies have found that their employees are likely to increase their productivity when they're using their own device because they're most familiar with that device instead of getting something else. They've already been using this, you know. Reduce company device costs. So as soon as your business encourages employees to use their own devices, then you reduce having to purchase any other and maintenance costs, management costs, that sort of thing. And the ease of transition. So in other words, you do have to do a management type program, and we're going to talk about that in a little bit. But once you have this, it's very easy because there's ways that you can, if you have a good policy or management program in place, you'll be able to manage and access your company network without interfering. So you don't have to take the actual mobile device, like you don't have to get it from the person and then do some stuff. They have it already and they've left, right? So it means that you can create a new employee should they start, and you can terminate access. Just very simple. You don't have to actually have the device. Improved employee loyalty. Believe it or not, you can increase your employee loyalty to your company by allowing them to feel more control of their work and the clear bring your own device strategy. Employees are found to increase productivity, as we mentioned, and they feel empowered. They feel empowered when they're using their own device. And it's seen as a job benefit, right? So many professionals see it as a perk. If you implement this bring your own device, it shows that your business is progressive and technically enabled. Employees are generally reimbursed for using their own device. But there are some challenges, so I just put them quickly up here. Control of security of your company data without controlling a mobile device. There's a number of applications you can use to secure the data on the mobile devices. You can find a solution that secures the data without controlling the device. It's essential to do this. You can maintain employee privacy. That could be a bit of a challenge, but it can be done. Again, security measures over employee mobile devices must secure your company data while at the same time have a balance, and a balance means the employee's privacy. So there is some software solutions out there that offer that. And then getting employees to follow the policies and the guidelines. So a concise bring your own device strategy involves developing a thorough policy so your employees are clearly understanding their rights, the benefits, and obligations when they're using their own device. So bridging the gap, HIPAA and bring your own device. The key here is to make sure that mobile devices do not place patient privacy at a risk or allow a criminal to hack in with, an easy point into the network. So a comprehensive mobile device management solution is really important at this stage. Okay, it's designed to empower your workforce with the power of mobility and enhance employee productivity without compromising security. So an MDM, this is called an MDM. An MDM means that software manages the smartphones, the laptops, the tablets, all under multiple under different operating systems. So you could, somebody has an Apple, they're using iOS, somebody has Android, you're on Windows, you're on Mac, Chrome, all of that is available. And it lets you just operate. So again, I'm just going to say it empowers your workforce, enhances productivity, and manages the devices. And that's what a good MDM program does. So getting into the rest of the presentation, I'm going to be discussing some successful steps for implementing a bring your own device policy. So you want to appoint a small dedicated team to take charge of evaluating your current bring your own device state, devising effective goals, and developing a strategy. So this should really include members from IT, compliance, human resources, and legal. You want to be able to define and align the goals. So to create the viable strategy, objectives for the bring your own device policy should be defined with a clear understanding of how they align with your organization's overall strategic goals. So a bring your own device strategy can only be successful if the goals are, tied in with your business goals. Your bring your own device goals should reflect a balance of enablement, empowerment, and security to the organization. Understanding how bring your own device is used today, that is definitely a great step. Once your overall goals are determined for this policy, The team should gain perspective from members of various units, including sales, C-level executives, human resources, and other key departments. They should help to determine which personal devices and applications, like personal cloud services, all of those are used today. So if you're using them, you need to understand what you're doing and what your organization is using. How tech savvy are the users, and how the employees feel that these tools, how do they feel that they enhance the effectiveness of their productivity? So and lastly, I want to say here is, this is a big one. It's important to take a positive tone during the discussions. You don't want to be negative. You definitely want to be positive so that the users don't feel threatened with the loss of any rights or their tools. You want to understand your security and compliance posture. So establishing an understanding of your organization's risk threshold by conducting a vulnerability assessment, and it's also known as a risk assessment, and evaluate security and compliance requirements. You want to review the impact of your current bring your own device situation. Like maybe you have people still, currently using cell phones and tablets, but you don't have the policy in place. So you want to review that and situation and discuss it all here, put that down. You want to consider how the organization deals with remote access from personal computers or laptops, and then currently, and then that'll create a baseline of how devices such as the smartphones and tablets are being controlled. Start building a strategy. So you want to use the goals you devised and the knowledge that you've gathered to start building this bring your own device strategy. The strategy has to include policies, processes, and resources. So policies, you're going to set expectations by outlining the rules. That's what the policies are, and the requirements, and identifying how they'll be enforced. The processes then are the activities and the tasks that are applied to meet the expectations and to facilitate the achievement of the goals and objectives. And then the resources, and the resources should include people and the technology solutions and money that are applied to enable the effectiveness of the processes that are going to meet those expectations. Devise a policy. With a strong policy, it'll indicate which department and roles will be empowered with the bring your own device policy strategy in accordance with your goals. So you want to know which devices, which applications, and what level of network and database access are permitted for each person, or even each device, really. What constitutes acceptable and unacceptable mobile device use? It should be, it should define what password requirements are there. Is it, two-factor authentication? Determine the steps employees should take to backing up or updating their devices. There should definitely be that in there. And the steps to follow in the event of a loss, like so they lose their cell phone or it's stolen, or maybe somebody hacked into it. It should indicate who can connect devices to the corporate network, how they can be connected and authenticated, what data can and cannot be accessed, which applications are permitted, and the types of data that can be stored on mobile devices. The exception process and penalties for non-compliance should also be addressed. So in other words, is anybody going to be in trouble if they're not following that policy? Establish processes. You want to implement and enforce policies. So mature processes will enable the organization to be productive. These processes are going to help connect all the different parts of your organization. For example, the IT, you should notify them when a new employee starts, right? New employee begins so that the employee's mobile device can be enabled. Processes should be developed to implement and enforce policies. And you want to make sure that you include processes for provisioning and deprovisioning. As I had mentioned before, you get a new employee or somebody is leaving the organization. Acquire and deploy resources. The resource component of a bring your own device strategy consists of technical tools and the people who deploy and use them. Certain bring your own device tools can help protect your network and the data from vulnerabilities presented by these mobile devices. So you want to identify the right people to facilitate your strategy as important in selecting the technology. It's just as important as selecting the technology, really. People and technology together. As the program is implemented, additional roles may need to be created. Some organizations will, put somebody in charge, like what they call it, maybe a chief mobility officer, and their role will be to oversee the whole mobility efforts. And at the very least, you want to do additional training, which will, need to be developed to inform various parts of your organization about the impact of mobility. Educate, 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 educate. Policies and processes cannot be affected unless employees understand the reasoning behind them. So it's not like you just want to say, you got to do it like your mom would say, because I told you so. So you have to give them the reason. Bring your own device education should start immediately when users begin to work for your organization, and they should also continue with periodic refreshers. There's definitely bring your own device courses that can be held online or in person. One way to help users understand the importance of their bring your own device policy is to highlight intrusions and data theft incidents that have hit other organizations resulting from mobile device use, because it's kind of like a scare tactic, I know, but it's definitely important for them to understand that. Focus on the education by protecting not only the company, but also the employee's personal information. And then lastly, you want to revisit your strategy. So the bring your own device landscape, right? This consists of devices, software, cloud services, and it's all really fast moving. You get new phones, a new phone comes in, and you get a new phone, and next thing you know, there's a newer one. That sort of thing. Same thing with software, right? Software becomes obsolete so quickly. So your core team should continually revisit this bring your own device strategy. It's important. Oops, I accidentally hit. Sorry about that. It's important to conduct regular vulnerability assessments and review the policies and processes and resource tools and education to ensure that they're still effective. So that is all very, very important. It should be done at least once a year, depending on the dynamics of your organization. Usually in the beginning, we suggest that every 3 months may be appropriate time frame just to make sure that the policy has been developed correctly. Maybe there are some changes. And of course, breaches or added outages related to mobile technology may necessitate a re-examination of that strategy. And there we go. So this is the end of the presentation. I do have the successful steps for implementing the bring your own device policy. I can email that to anyone. I wanted to tell you that Navitend does provide consultation on HIPAA risk assessments and policies. We do help our clients build those policies, including a bring your own device policy. And we also provide mobile device management as well. And we do that for our clients. And if there's any questions, I know that the chat is running. I can definitely answer those. And my contact information is here. I did give you my phone number, my email. I would love, love, love to connect with you on LinkedIn. So please, go ahead. And I'm at the expo, so look for me there. And lastly, don't forget the free sneakers. Thank you so much.